Hello, how are you? I'm not going to give or get coronavirus from the video screen, so I'll take off my mask and greet you properly. My name is Sten Vermund, and I'm a pediatrician and infectious disease epidemiologist. We're in the middle of the COVID-19 response, the biggest infectious disease challenge to us since the AIDS epidemic or since the 1918-1919 influenza pandemic. We are interested in trying to help society get past this crisis period, especially the next 3 or 4 months. And one of the key issues is a person's isolation. Not everybody has a family unit or extended family that can help them shop, that can help them avoid fear or depression. People are out of work. People are concerned about where they're going to get their next meal. They may be concerned about paying their rent. There are people with special needs, vulnerable people in our population that need counsel. So we are launching this Telesupport, like telemedicine or telehealth. We're calling it Telesupport Initiative. The Yale School of Public Health is happy to play a role, but there are many, many partners. We are keen for those of you who are empathic individuals. You care about your neighbors. You care about your most vulnerable in society. We're keen to give you an opportunity to volunteer to assist. What we mean by telesupport is the ability to make a phone call, find out how someone is doing, find out if they're anxious, depressed, in need of social services, and be a friendly voice, a friendly listener. Very often, the phone call itself is immensely beneficial. The phone call reduces the isolation that people are feeling when they're being physically isolated. We don't want them to be socially apart from the rest of society. We want them to be networked and connected. So the reality is we're looking for people who feel comfortable talking to others, who care about their neighbors, and who would like to help us in this effort. The training is based on an already developed series of programs. The Friendship Bench is one. The Certified Nurse Aid training that the American Red Cross uses is another. You'll be hearing from Sir Patrick about the Silver Line. And the Silver Line has been a highly successful linkage strategy to provide telesupport for the shut-in elderly. So it's a blend of training for you to feel comfortable with routine calls, but also with complex calls. What if someone tells you that they're depressed and they're even thinking of hurting themselves? How do you respond to that? Let's say we have someone who hasn't eaten for 2 days. How do you cope with that? Let's say we have someone who thinks they might be infected with the coronavirus. How do you deal with that? And keep in mind, they may have medical problems that predate coronavirus. They may have hypertension. They may have high cholesterol. They may have diabetes. They may tend towards depression or anxiety. There's a whole host of challenges that they may be coping with. Some of them may be taking 5, 10, 15, 20 tablets a day, and they simply get befuddled. So we have a number of goals. Number one, to check in with people, to remind them to take their medicines, to remind them to take their blood sugar if they have diabetes or prediabetes, to remind them to take their blood pressure if they're struggling with hypertension. The ability to build a bit of a telephone relationship with selected individuals, and you can check in with them every day, every other day, twice a week, whatever's necessary, could be a very vital adjunct. You're in a position to advise them to contact their health provider, and we may be able to link them to telemedicine or even a visiting nurse or other services that can assist them with their primary medical needs. All of these special circumstances are why we are having you get some training rather than just giving you the phone bank number and getting you involved. We do think that some preparation is advisable. When I was a medical student, we had a lot of this kind of training and preparation so that we would be in a position to tackle anything that a patient might have to discuss with us. Nurses have the same training, social workers have the same training. Now, we're not talking about making you mini docs or mini nurses or mini social workers, but an empathic telephone support individual does have to have some training. We're very keen to have as many people who want to do this work enrolled into it because we know that there are telephone banks aching for more volunteers, and there are many organizations wanting this kind of service. For example, nursing homes have sometimes dispersed their clients. They are now in hotels, some of them, the persons who can take care of themselves the best. So they don't have that nursing home support mechanism. They're kind of on their own in the hotels. The nursing homes are doing the best they can to link with them, but they simply don't have the staff to do that as comprehensively as they would like. Homeless shelters have decompressed, and some of the homeless are in hotel rooms. There are folks who are disabled or have mental disabilities who could use a checkup and could use a check-in. We can link them to telemedicine, to doctors and nurses if we need to. We can link them to social services, such as food banks that are able to make deliveries. There's so much that we can do for people who are isolated, but not if we don't make that first contact. We have to find out how are they doing, and that's where you come in. A friendly voice on the phone for this telesupport activity. So we are looking to guide you in these videos, and we are keen to recruit you. Where you are actually deployed remains to be seen. Which agency picks you up for volunteer services, possibly even employment at some point. And there is a wide variety of needs in society at the present time. We highlight nursing homes and our senior citizens because that's where one of the greatest needs is, and hence a lot of the training is focused on this. But community health workers trained through this mechanism might be deployed in many other environments. There may be needs in homeless shelters that you could assist with, in food delivery. There may be needs for daycare centers for healthcare workers. There are healthcare workers who don't have anyone to care for their child. We need them in the hospital. We need some care for their children. There may even be some of this tutoring that many school systems are looking for people to help with. It probably will be distanced over the telephone, but you may be able to help in that regard. I could go on and on with all the different examples of things that you might be helping with. There could be drive-through coronavirus testing unit. There could be some role in a clinic or a hospital. It really is substantial, our need for community health workers to really extend the ability of our nurses, our doctors, our social workers, our nursing home employees, our homeless shelter employees, our teachers, to provide as much service as they can, given the limitations of this physical distancing strategy that we're using to try to diminish the extent of transmission of this serious virus. Thank you very much, and I'll be talking to you later.